could you please just introduce yourself?
Sure. Michael Ikniowski from the Maryland chapter of the American Academy of Pediatrics.
Go to the people. Okay. Allie, you want to introduce yourself?
Sure. I'm Allie Nestad. I'm a commission member, parent advocate.
Okay. I'm Ruth M. Norton. I'm here. Do we have Jacob?
Hello, Jacob Enzakan, Commissioner.
Thank you, Jacob. Appreciate that. Mangela Paul?
Good morning, Mangela Paul from Maryland State Department of Education.
Thank you. Is Cliff Mitchell with us today? Not here. Can you just keep going down the list, please? Is Susan Kleinhammer here? Okay. Any other commissioners that I did not call?
Susan was on the other link. So I don't know if she got the message that the link has been changed.
Okay. We'll ask, and Paula's not here either?
No.
Okay. We'll hope that she does get the message and make sure. Dr. Mitchell, if you will introduce yourself, thank you for being with us in person.
Clifford Mitchell, confused, but otherwise intact.
Okay, there you go.
Glad you're here.
And I appreciate that. Okay, any last call for commissioners that have not introduced themselves? Alrighty, thank you, Fred. We'll have to see if we have actual quorum, but I don't think we have any agenda items that will require that. Can we put up the minutes of the meeting, please?
The last meeting.
Of the last meeting, if there's any notes, emendations, or disagreement with the minutes, please raise those now. If not, could we get a motion to adopt the minutes?
Motion to adopt the minutes.
Second.
Got a second?
Second.
Okay, thank you, Adam. Thank you, Cliff. All in favor? Aye. Okay.
Aye.
It's like that cartoon character.
Okay, we're going to move to legislative updates, and Anna Kutzer from formerly Advocates for Children and Youth has resigned from the commission. She's gone on to other endeavors. But Adam, I will call on you first and see if you have anything. We'll go to Riley, and then we'll come back to the department.
Well, I mean, other than the department's bill, SB 203 and HB 252 about performance bonds and liability insurance, I had a conversation with Fred about this last month and I know Fred probably can give us an update. I spoke to a couple of insurance folks just to check to see if this would work. And both said on the insurance side of things, there was a concern because there would be an exclusion in any policy for fraud. So if someone committed fraud, there wouldn't be any kind of insurance coverage. And then on the performance bond, I talked to one guy who had never heard of such a thing in this limited scope for, somebody going in and doing dust testing. So Fred had some ideas potentially on amending the bill to make it that would actually have some impact. Fred?
Fred, did you want to have any comment on amending the bill? Sorry. We're having a little difficulty here. Thank you.
Yeah, I think, Adam, I think the important thing to remember is that the bill just gives MDE the authority and right to do the requirement. So I think, we'll look at either a bond. We'll also look at possible E&O insurance that'll, cover errors and omissions. Still looking at potential riders for pollution. So we have some options. So I think, just the bill, like I said, gives us the right to impose the regulation. So I think that's the first hurdle we got to cross first. But we are looking at some options. We've been in contact with Maryland Insurance Authority and the Maryland Home Inspector Commission. And so we're getting some insight from them on some possible options.
MHIC?
Yeah.
Maryland Home Insurance Corporation.
Yeah.
And this is on 203?
Yeah, 203.
I'm just gonna also encourage, right, anybody who is in opposition to actually show up at the hearing and testify, so we can know, not have to deal with it in the back room. And I mean that sincerely with all respect to everybody, because I think there was no opposition in the hearing. Is that correct or no?
Yeah, it flew through pretty fast. So
Yeah.
yeah.
And it's just easier for everybody to address that, better for the public to know that, more transparent. It is, I think, a necessary bill. And I testified in favor of it because tenants, homeowners, property owners could all get left holding the bag for an inspector who may be found guilty or may be found liable in civil court, but unless they have the money or the insurance to pay it, it's almost meaningless and a lot of meaningless action there. So.
Yeah, I mean, like, just so you know, I mean, we're not opposed to the concept, right? I mean, that's not an issue. It's just about, it sounds good that we're going to put insurance companies on the hook, but the truth of the matter is, unless we find it in, if it's a standard general liability policy, they're going to be excluded if it's fraud. I mean, if what happened, recently happened. So again, we're not opposed. It's just
Well,
a matter of what's real and what's not real.
Well, they don't necessarily, they have to get a bond. And they have to post a bond for MHIC anyhow, if they're contractors. Now, for inspectors, if they are both contractors and inspectors, but they would have to get a bond, and and they may not be able to get it on their insurance policy, but get a bond for the work you're doing. And I do think that is common in lots of opportunities, but we can debate this, but
No, it's not a debate. It's more about, is there somebody who actually bonds inspectors for doing this business? So, I mean, if we pass a bill, and again, we're not opposed to the bill, if we pass a law and then no one can actually abide by the law because no insurance company or bonding company will write it, then what's the point? And then literally, what do? Are you left with inspectors who are unable to do the work because they can't abide by the law? It's a question. Again, I don't know the answers. I just am asking basic questions.
right. Well,
There's a question in the chat.
yes, Dr. Mitchell.
So I admit I'm not familiar with the insurance space, but are there any, I'm just trying to think of other professionals. Are there any other professions that have similar kinds of bonding requirements, either in the health profession? I'm unaware of any particular.
I can tell you in lots of work that we do, Cliff, we have to put up performance bonds.
And you put those up
Put
individually?
them up individually, right?
Yeah.
So I think what Adam's trying to say is, will any bonding company do that? Thank you. Will any bonding company address that? I think they will. I think we have to put up bonds for lots of things we do on a performance basis that are not coming out of our general liability policy. So,
Question from Susan.
okay. So Susan, first of all, can you introduce yourself for the record? Because during introductions, I guess you were not on yet.
I did try to join with the
Okay.
link that I got last
That's fine.
night. Excuse me, I'm sorry, Ruth Ann, I was talking. There were like 7 people that were on the same link as I without it being the correct one. So I apologize for being late. I'm Susan Kleinhammer. I'm the accredited lead hazard professional commission member. And my question is, Ruth Ann, you say that you have to provide a performance bond. Do you do inspections?
When we're doing environmental risk assessment projects in New York State, for example, and other places, we're putting up performance bonds for that work.
So you actually do those risk assessments in-house yourself?
Depends on the location, and we don't do risk assessments as a normal.
So that, I guess that's my point, is just, yes, I've heard of performance bonds, but
Okay,
I, like Adam, would think.
Kleinhammer,
we need to
you
do a
asked a
little-
question. You asked a question. I was getting ready to answer it.
Okay.
And we have to put up my point is, we have to put up performance bonds for lots of different issues. What this allows for is either insurance or bonds. And I think that we can continue to look into it. I just stated that I am in favor of it. given our work history, and because we do not want residents or owners to get left holding a bag. And if we're going to have a civil penalty cap at 50,000, which I'm not sure I'm in agreement with a cap there, then we ought to ensure that people will be able to collect. The history in lead poisoning is how many children's families have gone to court, won judgments, and never collect. And I think we need to start to reverse that history. That's just my one opinion.
I'm not disagreeing with you, Ruth Ann, on looking into the matter. But I do think there's a lot of questions yet to ask. And I'll just kind of agree with what Adam said about availability and, you know, a lot of other variables that should be answered before we put it in as a law. Thank you.
Okay. Any other comments or questions on that? Fred?
A few in the chat from
Go ahead.
Patrick Connor. MHIC bonds is for the contracting party. Mr. Connor, you want to elaborate on your question?
Thank you, Dr. Banks. I can definitely wait till the public session. I'm just putting it in for just thoughts and record. I'll wait till the end. Thank you.
You're being invited to do that now, and I think it would be helpful. So please do proceed.
Oh, thank you, Chair. So I think the discussion, and Adam Skolnick let it off well. I think it's more complicated than currently being discussed. Clearly not opposed to it. I've had professional liability insurance, pollution liability insurance for 39 years. I'm well versed in the subject. I just want to make sure it's going to accomplish what the department and the public deserves. Adam's 100% correct. Fraud is not covered. What has happened in the last several years with inspectors would not be covered by professional liability insurance. The challenge with the discussion related to the occupant, it's contract law. Inspectors contract with the property owner or the third-party property management company, not with the occupant. That needs to be really thought out and understood with making things mandated.
Yeah.
Bonding. I don't think many of the smaller inspectors can even qualify for a bond. And that's my only comment. I'm not opposed as a person and as a firm owner. I'm not opposed to it because I've done it for 39 years. I think it needs to be understood before there's a lot of movement behind it to pass a bill.
Well, let me, Patrick, let me ask you a couple of questions, right? Or comments here, right? I get where you're coming from, get what Adam is saying here. There is no system. If you're a contractor, you may be a small contractor, but you're still required in most instances to get that MHIC licensure, or people won't use you, right?
Ruth Ann, I totally agree with you.
Let me finish where I'm going with this for a second, right?
Yep.
And so I think in the inspection community, there ought to be something that brings us to, and if you do MHIC, you have to put up a bond, you have to give your financial statements, you have to do certain things that then put you in the, qualify you for the Maryland Home Improvement Commission licensure. And I do think the attempt here by the state is to effectively, say, we've got to create something there that is an equivalent for this field, because it's not good for you as, I assume you're still called Connor Environmental.
I'm not. I'm Finback 670, but I'm with you 100%.
Okay, Finback 670 or Lead Tech or anyone else, right? We want to protect anyone following the law, doing the right things. The contract is with both homeowners or rental property owners, right? Want to protect them. And we got to find a way that if residents are also, we're trying to protect resident health. We want to put a high bar on what is an environmental health inspection. So do you or Adam have thoughts on that? Or Susan?
I'll speak real quickly. I currently don't. I think what should be gathered, and Adam alluded to it, is to bring in some insurance professionals, mainly because bonding is different than insurance. And to really get to the crux of the matter, which I support, protection of the resident, protection of the occupant, yes, as well as the property owner, but paramount is the occupant. I think you have to have a system that may be state sponsored, that inspectors pay into, independent of attempting to get the insurance industry at large, which, by the way, insurance in this arena, and I'll let anybody else comment, is claims made, and they're not admitted carriers. They're surplus line carriers.
Yeah, that's been the case for 30 some plus years. So.
Yep. And I just think people need to really understand that. So I'll be quiet. But I think we should consider state sponsored program.
Yeah.
By the way, I'm sorry to jump in with that, but
Sure,
Pat's and Patrick and I have not talked about this. His thought is simplistic genius. I mean, there is a methodology, right? The real estate commission has a fund that realtors and brokers pay into.
Yeah.
So it's not like we would be recreating the wheel with that concept. And then MDE could, oversee the funds like the real estate commission does. Yeah, I think that's a really, the agents pay into it. So.
I agree. I think it gets to the same result, right? It gets that inspectors would have to pay into the fund. It may need to be, it may need some seed money into that fund as well. And we have a period of time of ramping that up, but that's not a bad idea. And agree. Susan Kleinhammer?
Thank you, Ruth Ann. I agree with both Adam and Patrick on that issue. I think that's a great idea. I also just want to make sure we understand that, what inspectors are going to do. And I'm not opposed to it, but what it's going to do is they're going to pass that cost on into the cost of the inspection. And one of the things that it will do is just increase the cost overall of performing inspections.
Just say what's going on. Okay, thank you. All right, thank you. Any other things you want to bring since we started with, Adam, are you good with all of your other?
Yeah, I don't see anything else that's of major impact right now.
One is the
House bill, Senate bill.
Senate bill, I believe. 181 is the lead ammunition from DNR.
Yep.
They had a long discussion about it yesterday. Kind of trailed off towards the ends of it, so I'm not sure where they ended up. But it was a lot of representation from the pro side of that, which was shocking to me. I thought it was going to be a lot more pushback. So, but we had made some comments. We kind of stayed neutral to it, but we did supply some comments for that one. But yeah.
As a courtesy, speaking, can you put yourself on mute, please? Thank you. You did testify on the lead and ammunition bill. Any other thoughts about the hearing?
Sure. So I won't talk too much about the MD bill just because we've already talked about that extensively. GHHI also testified in favor of Senate Bill 181 that is sponsored by Senator Young, and that would require that the Department of Natural Resources phase in requirements under regulation to phase out leaded ammunition for guns where there is no commercially viable alternative. I think that the hearing went over overall pretty well. There was a lot of opposition that was stated. It seems that the two main arguments in opposition to the bill at this point are, one, whether or not there are commercially viable alternatives to leaded ammunition that's currently used for guns. And secondly, whether or not there is viable or like specific academic literature showing that this is risk. Oh, sorry, Jacob.
The bar.
No, thank you. I do think that both of these issues were addressed during the committee or during the hearing. The sponsor panel was primarily composed of experts in the field who testified about that. We specifically testified about specific academic literature showing this to be an issue. The study that we cited was out of North Dakota School of Medicine in 2007. And yeah, right now it's with committee, so we will update as we learn more.
Thank you. Any other legislation that you want to talk about? Question, hand up from Michael Ganowski, Doctor.
Yeah, just one other bill that has been introduced is House Bill 196. It's a bill to expand the heavy metal testing of baby foods to include infant cereals and infant formula. I know that rice cereal has been a problem with arsenic in the past, and I don't know how much heavy metal contamination of formula has occurred. I have to look into that more. But the Academy chapter is decided to support this bill.
Okay, and that is House Bill 196, which will circulate to the commission, and the Academy is in support.
Yes.
Okay, thank you. Riley, you have anything else? And then we'll turn to other commissioners. Dr. Mitchell, does the department have anything that you're aware of on lead? Your department?
No.
Okay, thank you, sir. Go ahead.
Sure. So we have at this point 2 bills that we know are underway with DLS. We don't have a bill number yet for either of them, but they've been submitted for request by Delegate Rosenberg. One of them is a bill that would modify the requirements for MDE to send a notice of defect for lead under 6-819 of the Maryland Environment Code. This would remove the requirement that was added in 2019 to require MDE to do an independent inspection, so to return to the pre-2019 standard while keeping the EBL risk level at 3.5 micrograms per deciliter. The impetus for this is that we've had, to no fault of MDE, we understand that they've been doing great work going out and doing inspections. The issue is that while this was added in 2019, when the level was lowered to try and as a compromise to ensure that the cases that NDE was sending a notice of defect out for did actually have issues primarily at the home, what we found is that even for cases where there's been really high lead levels, that this has delayed things significantly for those kinds of cases, in addition to other cases as well, since that's been implemented. That's what we've been seeing in our cases. So we would like to return to the pre-2019 standards so that we're making sure that we're not leaving anyone behind or delaying any care, especially where there is a positive EBL level. That is currently in drafting with DLS. It has not been introduced yet, so we will update the commission when it is. And then the second bill that's being introduced with Delegate Rosenberg, I discussed this briefly at the last commission meeting.
And let me ask,
yes.
Is there anyone from Delegate Rosenberg's office on the line?
Yeah, I'm here. Delegate Rosenberg's Chief of Staff, Sam McGranahan.
Okay, Sam, they'll ask you to weigh in after Riley finishes. Go ahead.
Sure. And the other bill that we are asking Delegate Rosenberg to introduce is one that would include or bring into inclusion under the reduction of lead poisoning in household subtitle, single tenant occupancies. What we've had is a lot of people who have come to us over the past several months and over the past several years who specifically are renting domiciles that, they do have a valid landlord-tenant relationship, but they do not currently qualify for coverage under the lead subtitle because they're renting a room that itself doesn't include something like a bathroom or a kitchenette, but they're still given access to those kinds of amenities in other aspects or in other places throughout the building that they're in. We understand that there's some concern about how this would be regulated, had some brief discussion. And so the way that we're trying to draft this to address those concerns up front is to include in the bill language that it would require that those tenancies are still provided access to those kinds of amenities. So still provided access to bathrooms, cleaning facilities, kitchenettes, so on and so forth, so that this isn't covering things like storage rooms or other things that clearly wouldn't be covered. And also to make it easier for MDE to regulate so that you can just focus on the areas where they're given access to as part of their lease. And yeah, and that's it. So those are both currently in process with DLS. We'll update the committee or the commission when we learn more. The last bill that we wanted to flag, this isn't something that we're introducing, but something that we've seen, is a bill that was introduced by Delegate Addison relating to, so this is House Bill 59, real property, expedited wrongful detainer proceedings, property for sale or lease. The reason that this caught our attention, and we're not opposed, so what this bill does is it expedites proceedings for houses that are listed for sale or listed for lease for wrongful detainer proceedings. And of course, we agree with the intention of the bill if there are people who are wrongfully, who are essentially squatting at properties where they have no lawful right to be there. We've had several cases just in the past several months where lawful tenants have come to us where their landlords have filed wrongful detainer cases against them in an attempt to try and evict them even faster, or possibly to circumvent the requirements of the lead statute. In both of these cases, or in the cases that we've had come to us, the tenants were trying to get the landlords to address the lead issues. Landlords refused, and then they filed wrongful detainer cases.
So on the last one, we're just going to watch this. It's becoming a trend in the courts, and one that we would like to meet with the property owners associations about, and just to be able to get ahead of sort of a manipulation of that potential law. Definitely in favor of that. Sam, we thank you for being here on behalf of Sandy Rosenberg, who's in session. Did you have anything else to add to his bills? I know his efforts over decades has been phenomenal on behalf of lead-free children.
No, I mean, those are both bills are with DLS right now. We submitted them on the 23rd. Sorry about that. We're hoping to get those back soon. I'm sorry. The session bell is ringing right now. We're going to get those bills back soon enough, and we'll make sure everyone knows when we do.
Okay, thank you, sir.
Thank you so much, Sam.
All right, any other questions regarding legislation? Anybody else working on anything? Nadia from Renters United, anything there?
Yeah, thank you. Currently, all of our legislation is on the city council level, so nothing on the state.
Okay, all righty. And anyone else? Thank you, Adam, who sent a copy of the state fund, real estate guarantee fund. I'm going to get the name wrong. We will share this with the commission and with the committee, as I'm sure you're likely doing. But it does establish a $250,000 minimum fund to oversee various activities related to real estate. I think it is the same concept that could be adopted for the state. I'll ask Fred and MDE to look at it and maybe report back in the next meeting about that, because I do think we need to make sure we're protecting responsible owners and residents on this issue. Really quick, I don't know if NRDC was able to join us, if there's a member from NRDC. So I've asked Riley to just give a quick update of what is happening on the lead and copper rule nationally.
Sure. So at this point, we've been communicating. Yes, briefly. So with the NRDC rule, essentially we have until March, I believe it's March 13th or 17th, to submit an amicus brief. Right now, what we are planning to submit a brief on is discussing the disproportionate impacts of lead on marginalized communities, and also to look at specific cities where there have been substantial work already done showing that it's possible to be able to meet the deadline that was established under the Biden administration, under the improved lead and copper rule improvements. So right now, as far as drafting on our end, we are meeting with, we've already met, and we're in the process of discussing with the Harvard Environmental Law Clinic, of working with them to draft the amicus brief. Right now we are, so right now that's currently where things are at. We're going to be working with them, and then we will update the commission as we have more information.
Thank you. And on that note, where EPA, I think, is supporting the lead and copper rule, if I understand, or
Yeah.
continuing to do so. EPA also released environmental education grants. We will share with the commission the link for people to go on there. This is very similar to the environmental justice grants, but obviously moderated a little bit by the current administration. But we do want to share those with communities and entities throughout the state as an opportunity for up to $250,000 for lead education or other related environmental issues. So glad to continue to see progress on that. I don't know if Celicia or Carly were able to make it today. We may have to move that to the next meeting. So I'd like to go to the update on the lead grant and loan programs for DHMH or MDH, if you have any. Sorry, or if or DHCD has it.
On our Healthy Homes for Healthy Kids program.
That's right. That's right.
So we're continuing to do active outreach on a number of cases. We've been talking with DHCD about how we popularize and familiarize the program across the state. One of the things that we have been talking about is, and there's no way of dealing with it effectively at this point, but making sure we have good communication between the Department of Housing and Community Development, Baltimore City Department of Housing and Community Development, Baltimore County Department of Housing and Community Development, because all three of them, and now Cambridge as well, have loan programs that are similar and overlapping, but not identical. And each of them has performance goals that they would like to meet. And that we want to make sure that we can most effectively serve the many families who need services amongst those four now programs. The other part of this, I think, to keep an eye on, although it's very early and I have no useful information at this point, is that the department is in receipt of a very large multi-million-dollar grant on rural transformation of healthcare. And I think that one of the impacts of that is going to be a very, very significant focus on our rural communities. And how we do this program in rural communities is very much more complex than it is in Baltimore City or Central Maryland. I think it is a challenge for the NGOs with whom we work. It is a challenge for us. It's a challenge for the building community. It's a challenge for MDE. It's pretty much a challenge for everybody.
There's a real opportunity in this.
But it's a huge opportunity as well. And so I think some strategic thought about that on the part of the commission would not go amiss. And I think we're going to be talking about it a lot.
Okay. So potentially, I keep thinking of Westernport, right?
Yep.
And the health issues that are resulting from the flooding and the lack of heating and cooling options there. That it's like a health time bomb going on. So I do think this is really critically important for people to understand that this is the flexible waiver from CMS. We're very fortunate to have Secretary
Seshmani,
who came from CMS, heading us up and being able to tap this. It is going upstream, and we would like to get input on that. We have a lot of folks thinking about these rural communities and on the Eastern Shore, Lower Shore, across that way. So we'll work to put something together on that. And if there's a way that the department could come back and give us a little bit fuller pathways to opportunity there. But one of the things, Cliff, you also said, is you're noting not only the Healthy Kids, Healthy Families program,
Healthy Homes for Healthy Kids.
Healthy Homes for Healthy Kids, the three others, this seems to me an opportunity to kind of put a chart together on eligibility and programmatic work. So I think we will work with you all to do that, and the three counties that you noted, and have a resource that I hope will go up on all of the cognizant agency websites, ours and others, so that people can access those resources. So thank you for bringing, and they're all active.
They are all active.
Okay.
As
And
far as I know, that might not be true for Baltimore County.
okay.
And I think I heard just recently that they may have suspended operations in Baltimore County. I cannot speak for Cambridge. Baltimore City, as far as I know, is still active. And if Catherine Taylor is on, or anybody from Baltimore City.
Nicole, are you on, or Kat Taylor?
Hi, I'm here. Nicole's not here today.
Okay, thank you.
Hi, Catherine.
So
Hi.
you're not talking about their HUD grant, are you?
I am talking
Okay.
about their HUD
Their
grant.
HUD grant, okay. Catherine, do you want to give an update on where you are on an award and spend on your current lead program then?
Yeah, sure. So far, our grant that we were awarded last year is making really great progress. We've exceeded most of our goals that we've had established up until this point. We actually even got some really good news last week that we were potentially going to be awarded again for the new lead federal funding. So that will that also speaks that HUD has seen some really great progress with our team, and we're working every day to increase our outreach and just get more people aware about the program. I'll say the one thing that is one of our greatest challenges is our contractor capacity, which we've been working with our procurement offices to really get that moving. And we've also have started this contractor outreach campaign that we plan to use our social media platforms and trying to use other contractors to also assist with that. So we've been making some really good progress, I would say. In regards to our spending, we've spent about $755,000 so far, which is well above what we've expected at this point.
And that's out of what, 5.5 million, or what is the amount?
The total amount for the 4 years is 5 million.
5 million. Okay.
5.8 billion.
And the new award would be what?
It would be 4.1 million.
Okay. And that's about to be announced or has been announced?
It's about to be. We did get the notification through HUD in our meeting. That means we're kind of in the beginning phase where we'll start negotiations soon.
Fantastic. Well, congratulations on both of those. That puts $9 million into Baltimore City for opportunity there. And let me go to Nicola Tran. Are you on, or somebody from
Yep.
the state?
Yeah, I'm here. So as Cliff mentioned, we're working on some ways to spread the word on the available Healthy Homes for Healthy Kids program. On our end, we started working on a more general lead marketing campaign because we now have 3 lead programs under our umbrella, and there's really no reason to compartmentalize them, as they're all trying to spread awareness about the same issue. And we just need people to be aware and then submit their application, and then we'll figure out on the back end which program funding they will get. So we should really coordinate that messaging with the other county and city programs to make sure that this campaign benefits all the programs across the state. So I'll be reaching out to you guys at the city to see what you have done. If you already have marketing materials, and then we'll compare what we have come up with and see to make sure that we're aligned in messaging there.
Nicola, do you currently have a social media campaign or anything that is currently happening, or current marketing materials you could share also with the commission?
Yeah, we have a marketing brochure, but it's it's pretty old, so it's currently being overhauled. And then we're gonna align the social media campaign with that, new messaging on the brochure. So I'm not sure it makes sense to share the old version, but I do want to make sure that we incorporate it in the new version, what messaging is used potentially already by others. So I think it makes sense to do it all at the same time right now.
Not only the rural community opportunity, but I do think a common dashboard that on all of these programs that are available, the monies that we have, the monies that a couple of other counties have, that the state has, and certainly the city, having a common kind of dashboard of where do I go for resources and doing that. Also, can I just suggest that we bring all the communications officers for all of these programs together and convene them to talk about how we're marketing these programs in meaningful ways. We've done that in Pennsylvania with a lot of the stuff we're doing around Lancaster and other programs, and have a real coordinated way of getting people to know between the city, the county, the hospital, the state, where to go and what path to take. I think this is certainly an opportunity to get that and use that as an educational opportunity, so that if I'm a parent looking for resources or otherwise, I would like to do that. So I'll reach out to you and see if we can't convene those comms folks together.
I was just gonna say, maybe it makes sense to form like a subcommittee or subgroup.
That's what I'm getting, right? Getting to. And Kat, we'd like you to do that as well. If you have the point of contact, Cliff, for Cambridge, that would be.
Let me work. I don't get offhand, but.
And then is it DACD who should be leading on the Healthy Kids program?
Yes.
Okay. So that would encompass, Nicola, over to you, the MDH CHIP program.
Yeah.
Okay, great.
Yeah, and then we're going to integrate that into our general lead campaign anyway.
Okay. Well, I think we have certainly a lot of robust opportunity for Children's Environmental Health Month in June, American Public Health Month, and Lead Week month in October to highlight these. But this is a lot of there's probably more resources than we've had in a long time across the state. If one thing, Dr. Mitchell.
So Nicola, just two questions for you. One is, were you aware, am I correct that Baltimore County has actually suspended their program?
I'm not sure.
Okay, I will reach out and find out about that.
Thank you.
You know why?
I think, well, I don't want to speculate because I am so tactful.
Okay.
It would have nothing whatsoever to do with the federal government as far as,
Okay.
because that's totally functional.
Okay.
But I do have another question. And that is, Nicola, it might be helpful, I think, for you, that is to say DHCD and MDE and us, to have a conversation about some geographic thought and maybe the use of the registry and registry data and lead testing data to think about how we might better identify possible opportunities across particularly the areas where we don't have a lot of service now.
Yeah.
So mapping that out.
Yeah.
And that really is more the rural communities.
Yeah.
Right. So if we're able to do this mapping and lay that out, I think that will tell you that.
We have actually done the mapping already.
Can you share that?
It's already publicly available on our website, EPHT, Environmental Public Health Tracking.
Okay.
At the census
And
tract
can you say just lead and you?
It is specific for lead.
Okay. And what is the website?
It's on the Department of Health. It's our Environmental Public Health Tracking portal.
So just go to MDH.
Yep.
Or at
and just put in environmental public health
Is it
tracking.
mdh.gov or what is it?
We are a .gov.
Yeah, but is it mdh.gov?
No, it's health.maryland.gov.
Health.maryland.gov, okay. And then,
And then you look for, you can either put in lead or you can put in environmental public health tracking. And it will take you to our map,
Great.
which has census tract level data on children with elevated blood lead levels.
got it. Okay. So we'll put that out to the commission in the public notes as well. And Cliff, do you have somebody you want on, to put on the, either the rural or the
So
resource campaign?
Thelonious Williams, Theo.
Is Theo on the line?
Yeah, I'm here.
You've been assigned.
I'm fully prepared and excited to be part of it.
I'm sorry, man.
Are there
No,
other,
no, I'm excited to participate.
are there others on the commission who would like to participate in the strategy on rural communities or the marketing of resource? City of Cambridge has raised their hand. Yes, thank you. Go ahead.
Thank you, Ari. Ari has put in the website.
Okay, I'm also, he's got his hand raised. Ari, do you want to say something?
Hi, can you hear me?
Yes, sir.
Yeah, this is AC Ray. Yeah, I would like to participate in that. That was it.
Okay.
I raised my hand just to make you aware.
Hey, nice to see you again.
Hey, good to see
We
you.
also have Adana.
Adana Patterson. That is a dream team right there.
Okay. And Adana, are you just saying, I'm calling on you?
I'm sorry, can you repeat that, Rufan?
I was, your hand was raised, so I was calling on.
Yes, I would like to participate as well.
Okay, Cliff just called you the dream team.
Thank
Other-
you, Dr. Mitchell.
Others on the commission who want to participate in either of these, rural strategy or the media marketing campaign? If not, we will revisit that with folks. Thank you, Dr. Mitchell. There's a budget update line item for Paula Montgomery and you, and since you are like the one arm paper hanger today, Fred,
I'm sorry.
and let's go.
So we had,
And I do think we were joined by Rick Kessler as well. I just wanted to acknowledge that, and I appreciate him being on. Thank you.
we had two fee increases approved last session, one for lead-free certificate fees from $10 to $30 and another for lead rental registration fees from $30 annually to $75 every 2 years. The lead-free fees went into effect July of last year, and the registration fee for $75 went into effect January of 2026. The only other thing I have regarding budget is our water administration was approved for federal funding for lead replacement lines. We've been working with them as well as MSDE, Mangela, to look at areas that are pipes being replaced just to identify if there's any spikes in elevated blood levels. So, yeah.
Okay, thank you for that. I think, I'm not sure what the Home Commission, Maryland Home Commission comment is, so I'll have to circle back to Wendy. We are looking, go ahead.
Fred, so just on that, and that's great to hear. Do you, does your Attorney General have eyes on the lead and copper rural improvements case? Just because that might have some impacts on the federal funding for water line replacement. So if they don't have eyes on it, I would recommend that they have eyes on it soon.
Yeah, I'm not sure. Yeah.
Okay, we have a meeting that is ongoing on that. MD is welcome to join it.
Okay.
Okay. So moving to the public meeting location, we are looking to have a public meeting in June and wanted to get input of meeting out in the community. And I think given that we're doing all of the resource mapping and where we are and maybe even in rural community, Cliff, I'd like to get input from the commission about where we might hold the commission meeting that isn't in the conference room here, but out in the public. And we're going to try, if it's possible, to get Secretary McElwain to join us for this meeting. But is there any thought or input from the commission of where one might suggest? And we don't have to do just one. We can do two and do one in October as well. But we're looking for input from the commission and the public as to where we might hold this meeting. And I think Cambridge is going to volunteer here in a hurry. So that is one, right, to do that in Eastern Shore. But any other thoughts from the commission on this? If not, we will name a location. Yes, Cliff.
Well,
And Ellie just bugged me if you're raising your hand.
I would say that if you look at the data, you know, we have relatively higher rates in the western part of the state, in Cumberland, and I might suggest looking either at Cumberland or Hagerstown, where we have and if we did it, either of those, but particularly Hagerstown, would also have college facilities that might be relatively easy to use for a public space.
That's fine. And I do believe, if I'm correct, that the commission will reimburse you for travel if you have travel expenses that occur.
Don't look at me.
They won't, everybody but him. Nadia, you had your hand up. I think Hager sounds good.
Yeah, I just had a recommendation for if there was going to be a Baltimore City one, but understanding Dr. Cliff's remarks about geographic location.
So is your recommendation that one of the two might be Baltimore City and one might be rural community or more rural?
Yeah, I was thinking one of them might be Baltimore City, but I do feel like because the city does have other programming happening, maybe it would be nice to do both in a more rural location.
Okay. All right. Thank you very much. Dr. Banks, do you have any thoughts on it yourself?
I agree with Dr. Mitchell.
Everybody agrees with Cliff? Yay. Mark this day down.
That may
right?
be the first and last time.
Okay, please look for an announcement on that and planning on that shortly. All right, MDE, we are, any other comments before we move to the quick hits here? Yes, go ahead, Susan Kleinhammer.
Thank you, Ruth Ann. I just want to make sure I'm asking it at appropriate time are we at the point of new business?
Yes.
Okay. Well, what I would like to do is to indicate, I would like to propose a motion to have a subcommittee for housing.
That we did adopt that. We are working to get the subcommittees in place. Housing is one of the ones that came out of the strategic plan. But if you want to make a motion, we can do that. Go ahead.
Yes, please. I would like to make a motion for a subcommittee for housing concerns.
I got a
Happy to second.
second. All in favor?
Aye.
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 Any opposed? Okay, there you go.
Thank
We'll
you.
add that to that. And we'll get with, we've got to get together with Paula and move those forward. Okay. MDE additional information?
There was a sentencing hearing for Green Environmental on Tuesday. The judge agreed to 5 years suspended to probation.
So no incarceration.
Correct.
Okay.
Yeah.
And MDE is appealing, not appealing?
Not appealing.
Not appealing. Okay. Any comments or questions on that? Okay. MDH, any additional?
No additional. I will say I have another meeting I have to go to.
All right,
now.
thank you.
Sorry. I apologize.
Dr. Janowski, anything from AAP, please?
Nothing at the moment, no.
Okay, MSDE, Mangela?
Nothing at the moment, please.
Thank you.
Thanks.
Insurance Administration? We may be coming back to you on bonds, insurance, et cetera, questions. So being available for that for MDE, very important. I'm sorry, go ahead.
We have vacancy for that one.
You have a vacancy. Okay. So Benita Cooper's off.
Yeah.
Okay. So the MDE is working on that vacancy.
Yeah.
Okay. Nicole or Kat from city?
No further updates.
Thank you. Brianna, I saw you were on there. How grateful we were to have Dr. Taylor last month. She was terrific. Do you have any updates?
Only update that we have, I know we mentioned in the last meeting last month about our marketing in partnership with iHeartRadio because of the inclement weather that was supposed to be broadcasted, start streaming last Monday, but we won't be able to start that until the following Monday.
Brianna, can I ask you and your team to be a part of the committee that we're putting together on marketing and engagement that we were talking about earlier? Can I tap you?
Sure, and I apologize. I had to step away temporarily to talk to the contracts unit, so I probably missed that, but no problem.
Okay, thank you. And Baltimore Renters United? Anything else there?
Yeah, not many updates right now. As I mentioned, currently primarily focused on some Baltimore City Safe Homes Now kind of bill suite. So yeah, those are our most updates.
Okay, and could you share any of those that may cross-lead with the commission so we can circulate them for knowledge if there are bills in the city council?
Okay, yeah, I definitely can. Primarily, this legislation actually does work on like the pre-rental inspections. So I do think lead touches on it a bit. Happy to share.
Thank you. Any updates from others on the Green and Healthy Homes Initiative? Okay, thank you. We will be putting out a dashboard on the MDE work for the next meeting. Nicola, did we miss you? I'm sorry.
Yeah, I just have one additional.
Not need to skip you.
Okay, I just have one additional update. We are looking for a program manager for our HUD program. The position, it was posted on LinkedIn. It's still open until tomorrow. So if anybody knows anybody, we're looking for good.
Okay, and did you share that link with us? Could you share that?
I can put it in the chat if you like.
Okay, great. And do you have a lot of applicants?
I don't know because we don't get them until the position closes from HR. I hope we do. We shared it everywhere we could.
So this is for your lead program, right?
Yep.
And just one question for referrals. They usually require a 0.75. Is this person going to be a 1.0 just on that grant, or will they be working on your other lead grants as well?
Yes, correct. It'll be a lead program manager, including work on other lead programs.
Okay, fantastic, great opportunity there, and to work with Nicola would be a great opportunity. Okay, Patrick, you had some other comments, and any others from the public, please. Thank you.
Ruth.
Your post.
Yep, thank you, Ruth Ann. Just real quick, I didn't hear it, but maybe it's already been said. Has Baltimore City Health Department provided the redacted environmental investigations just so the commission can review and see what the level of effort is to complete one?
I have to defer that to Fred. So Fred, could you follow up on that request?
Yeah.
Thank you. Thank you, Patrick, for that.
Thank you. And my second one, just a thought, and following along with everybody, with the number of invalidated inspection certificates increasing, is there a mechanism for the department to possibly, when property owners are not responding within their 30 days, to bring their property into compliance based off the invalidation process? Is there a way to tag their title or deed? So according to the environmental article, sellers are supposed to notify buyers, but I was just curious if how we're looking at 6-824 to ensure that information is in fact being conveyed to new purchasers.
So I think the real question, right, is the state taking advantage of that opportunity to tag the lien, right? First, do you know?
I don't know, but I was just asking. I think it's a mechanism.
Yeah, Patrick, I'm sorry. I turned to Fred to ask that question.
Oh, thank you.
So the answer is no, we're not. We are working with STAT to try to get updates on changing ownership. As of now, the property owner is required to notify us if there's been a change in ownership. We're not getting a lot of those notifications.
Yeah, I think this is a big, potentially big miss here, right?
Yep.
If you have invalidated certificates that are not being responded to, right? The opportunity to tag that lien.
Right.
So that any future buyer knows the responsibility of that. And I think I'd like to get a look at the law. Would that either prevent the sale until it's adjudicated? Patrick, do you know or recall if it would prevent the sale?
So I think what would happen, Ruth Ann, just from listening to attorneys, it would not enable the deed or the title to be clear, and most likely at a real estate transaction, it would pause it because it's not a clear conveyance. But I would clearly defer to the possible 5 attorneys that are on the call.
Yeah, I got it. But I tell you that, slowing a title clearance, if somebody knows it's going to slow their title clearance, it is a big incentive, right?
Yeah.
And if we're not talking about that more, talk about the things about public education that we should be talking about, that is one, but it would also require the state to take that action. And I'd like to ask the state to come back at the next meeting as to the reasons why that is not occurring, if it's not occurring, please.
If I have one more minute, my last one.
Yes, your last one. Go ahead, please.
So thank you. And again, in light of the what appears to be significant number of invalidated lead-free certificates, is the department working with the EPA for referrals to have the EPA enforce Section 1018, the Real Estate Disclosure Act, because those owners have not been providing disclosure because they're exempt, utilizing their Maryland 330 form. And now that the 330 form is exempt, it is possible that tenants, again, supportive of your prior discussion about education, that tenants are not receiving the required federal real estate disclosure under Section 1018, both at EPA 40 CFR 745 and HUD 24 CFR Part 35. They've just been void of that for potentially years. And I think that's an opportunity to restore education.
And given, we have seen enforcement actions out of the current EPA, including their $12 million fine of Lowe's, but they are advancing this work. And I think this is quite a smart idea. And I would bring them together. And then HUD's enforcement, Tara Radosevich is still there. I don't know if people are aware, HUD's Office of Healthy Housing was cut by 52% of its personnel. But if Tara Radosevich is still there, I think convening with EPA and HUD on this matter is one that could be a plan of action, and we should facilitate to do that. We did have a hand up. Did it go down?
Yeah, that was me, Ruth Ann. Thank you. Actually, Patrick kind of talked about it and answered my questions. The other thing I just wondered was, our annual report to the governor, has that been made? I know it's at the beginning of each year.
Signed off on. It did go. So I'm asking Fred if it has gone, and if it has gone, it does need to be circulated.
Okay.
I know I have not received a copy of that final. So if it has gone, it does need to go out to the commission and out to the public. And Stephanie Cobb Williams will tell us an answer, I have a feeling.
That report is currently pending Secretary's office approval.
I'm sorry.
Pending the Secretary's office approval.
So it is still, Susan, at the Secretary's office. As soon as she approves, then it will be released.
Thank you, Ruth Ann.
We will ask the question of, Stephanie, are you the appropriate person to ask if we can push this along in some way?
Yes, I can take that request. Wendy generally handles that report.
Okay.
Yeah.
Wendy is out. We will follow up, see where that is. Is Rick Kessler still on? Okay, we will follow up. Good question. I know it has been circulated in draft.
Yeah.
For release. Okay. Other comments? Questions? Okay, the next meeting is March 5th. You should be getting a number of things on committee work here. We are working with MDE to take the ones we already identified and get them in place. And I don't know who's putting the highlight marker there. Is that you, Fred?
Yeah.
Fred does not know how to color between the lines. We will see you March 5th
I'm having some issues.
and look for other things. The meeting has been concluded. Thank you.